Right, everyone. I hope those online can hear me again, and I hope you can both see the speaker and see the screen. Please put something through the chat if you can't. We're on to the next part of our session or our forum, and it's an exciting part. It's the microbial manipulation part. I'd like to introduce Dr. Alice Day, who's an academic dietitian here with us at the Queen Elizabeth Hospital, who is leading our research into diet and inflammatory bowel disease as well as PSC. So eating well with PSC. Thanks, Alice.
You. Hi, everyone. Thank you for coming out today, and thanks to everyone online. So as Rob said, my name's Alice, and I'm part of the microbial manipulation research program that we have here at the QEH. I thought before we get to diet, I might put some context to the research that's going on here at the moment. So we are currently a second year into our microbial manipulation research program that looks at diet and fecal microbiota transplantation for inflammatory bowel disease and now PSC. Within the diet space, we have a team of 5 research dietitians here that are looking at different aspects of research related to gut health. And our core focus is really on looking at development of new diet therapies, understanding what influences dietary patterns with people with gut disease, and improving access to evidence-based dietary information, which we've heard about. And this is some of our IBD team here on the screen, some who are with us this evening. I just also wanted to touch on some of the research that's currently happening. This is not PSC specific, but there may be some people online or in the room today that also have inflammatory bowel disease. So we have various different trials happening in our unit. We have a diet therapy trial for ulcerative colitis, which people with PSC are eligible if they have active ulcerative colitis symptoms. And we also have a fecal microbiota transplantation trial running at the moment for people with Crohn's disease. So moving on to the important question, is diet an important part of PSC? And the simple answer to this is yes. Diet is an integral part of overall PSC care and well-being. And these are really the 5 pillars of why diet is important. So we've heard this evening that there is not currently a treatment, there is not a dietary treatment for PSC, but diet is much broader than that. So diet has a key role in optimizing liver and gut health, a key role in prevention and treatment of other diseases that people living with PSC may have or be at risk of developing. Diet can play a key role in symptom management, prevent nutritional complications, and above and all, help to improve overall quality of life. So as we heard tonight, when after diagnosis with PSC, on the internet looking at what you can do, diet is something that certainly we hear from patients time and time again is something they are able to control. It is a modifiable factor, but the problem is at this point in time, the internet is littered with so many different types of diets. They very much lack scientific evidence for them. So at this point in time, there is very little scientific data on the role of diet in the development or treatment of PSC. The current focus of PSC, which I'll talk to you tonight, is about eating a nutritionally balanced diet. But certainly our research group is aiming to change this. So what should you be eating? So in the absence of a therapeutic diet for PSC, we really default to the Australian dietary guidelines, which are well evidenced as being a dietary strategy that Australians should be following for prevention of chronic diseases such as heart disease, obesity, stroke, diabetes risk, cardiovascular, liver disease, just to name a few. So the focus of the Australian dietary guidelines predominantly are a plant-based diet with moderate amounts of animal protein, calcium-rich foods, and sometimes including some junk food and alcohol. The dietary guidelines really aim to focus on limiting foods that are harmful to things like the liver, the gut, and cardiometabolic health. And when we talk about harmful foods, we're talking about a lot of the ultra-processed foods. So that's foods on shelves in packets that have lots of different ingredients that we don't understand. This is foods that have lots of different fats added to them, thickening agents, lack fibre, are very white and refined, processed meats, soft drinks, and then alcohol. So the translatable dietary principles from this to PSC are really around this general anti-inflammatory dietary advice, which focuses on the very first step is not a food-based strategy, but it's actually organisational. So it's really difficult to eat well if you don't plan your meals and your snacks. The focus of our diet should be eating more plant-based foods. So different coloured fruits and vegetables are really important for the gut microbiome, including grains, nuts and legumes, more fish, less red and processed meats, calcium-rich foods. Being careful with artificial sweeteners. These have just been identified by the World Health Organization as being carcinogenic. They're not something that we encourage. I've popped on the screen here to avoid alcohol with liver disease because as dietitians, we would default to the gastroenterologist for personalised advice. So this is general advice, and the important point in this microbial manipulation session is that a predominantly plant-based diet where we're getting lots of fibre in our diet is really important to feed the gut microbiome, and we'll hear more about that tonight. So as part of eating well with PSC, as we also heard from Brad, it's really important to adopt a healthy lifestyle, an anti-inflammatory lifestyle, which takes into account getting enough sleep, eating regularly, drinking water, having an awareness of your mental health and being courageous enough to seek support if you feel that you need it, being active, not smoking, and being cautious with alcohol. We don't want people following experimental diets off the internet because they risk nutritional problems. So we've heard about fatigue in the context of avoiding dairy products. We need to be careful that we're getting calcium-rich alternatives so that we're protecting our bones. If we're not eating so much red meat, we need to make sure we're eating enough plant-based foods with iron to prevent diet-related anemia. We need to be cautious with food and fluctuations in weight. This is particularly important from the perspective of protecting liver health long term. We need to be really careful with things like the keto diet, which is very high in different types of fats, very low in fibre. We want to be really aware about things like fatty liver, and we certainly don't want people following a carnivorous diet, which has implications for cancer risk and also ulcerative colitis. With all dietary advice, though, there will be different personal experiences, as we've heard. And really, in the absence of a defined therapeutic diet for PSC, it's important that dietary advice is personalised because people have different past medical history, different experiences with food, different food preferences. And so diet really is not a one-size-fits-all model. In people that also have abdominal symptoms, this can affect what you eat in terms of diet. So we need to be aware, again, that diet can affect gut symptoms. We don't want people unnecessarily avoiding or restricting food, but it is to be aware that there are different dietary components that can improve or cause gut symptoms, and personalised dietary advice is recommended in this situation. I'm not going to talk about diet for inflammatory bowel disease. I am aware that there is a close relationship between PSC, and that is certainly for a different talk. But just to highlight there that there are different dietary strategies for inflammatory bowel disease that may or may not be appropriate for people with PSC as well. And certainly an IBD dietitian and a gastroenterologist can help advise on that. So in terms of where you can access dietary information, so we've heard tonight about the PSC support websites. There is some dietary information on PSC Support Australia and also on PSC Support UK, dietary information on the gastroenterology website. For people with inflammatory bowel disease, we also have set up Deakin, which is Dietitians Crohn's Colitis Australia Network. We are a group of over 50 dietitians that all work in gut health. And so there are many people, there's a Find a Dietitian button on that website for specialised gastrointestinal advice. I just wanted to bring your attention the first step in the dietary research that we'll be looking to start here for diet and PSC. I feel like this is very topical and on point after Brad's presentation and the questions that have come through the chat and been asked. There is very little information on the role of diet in PSC. There are lots of different personal experiences on things that people living with PSC believe help their symptoms or their disease. And we want to know more about that. So we have flyers outside. We would love you to get involved. We need a couple of people to help us pilot the survey to make sure that it's easy to complete. And then this will be being rolled out across Australia and New Zealand over the next 12 months to be the first study in the Southern Hemisphere to understand more about the role of diet and PSC. So the take-home messages from my talk this evening really is that diet is an important part of PSC care. Yes, we don't have a therapeutic diet, but liver health and general well-being is important. Make the time to plan your snacks, adopt an anti-inflammatory lifestyle. If you have the time to do so, we would love you to participate in research. And if you need to, see a specialised dietitian who can provide you with personalised advice. It's really important to understand that food should be enjoyed. It shouldn't be feared or unnecessarily restricted or confusing to anybody living with PSC. So I'll leave you with that slide. Thank you.